Hello, everyone, and welcome to this Vetfolio Voice podcast sponsored in part by Boehringer Ingelheim Animal Health. Today, I'm joined by Dr. Grant Beckett to discuss canine and feline diabetes, as well as some exciting updates with regard to ProZinc insulin. Dr. Beckett earned his veterinary science degree from the University of Pretoria in South Africa and is a member of the Royal College of Veterinary Surgeons. Dr. Beckett practiced as a small animal general practitioner for 5 years, as well as managing an emergency hospital. He began his career in veterinary industry in 1997 and went on to earn a postgraduate degree in business management in 1998. His industry career has included positions with companies such as Monsanto and Fort Dodge before joining Boehringer Ingelheim in 2009. He was recently promoted to the role of Technical Marketing Senior Associate Director in the Pet segment. Welcome, Dr. Beckett.
Thank you very much. It's good speaking with you, and thank you very much for having me on.
All right. First question. How common is diabetes in our pets, and are there differences that we should know about between cats and dogs?
It's probably first well worth noting that diabetes is the most common of the endocrine diseases in both of these species. And interestingly enough, it's 3 times more common in cats than it is in dogs. The good thing is that we do have some pretty robust data, which would indicate that in the US specifically, there are about 57 cases per 10,000 of cats under care that had diabetes back in 2006. And then 10 years later, these data were measured again, and it increased to almost 68. So that's about an 18% increase in that species over 10 years. Wow. For dogs, the number is a little more dramatic. It was about 13 cases per 10,000 dogs under care back in 2006. And by 2015, that number was up to 24, so an 80% increase. So the prevalence is increasing in both species.
What are some of the signs and symptoms that clinics and pet owners need to be aware of?
Yes, it's all about the symptoms. If the owners aren't picking up on the symptoms, then they're not going to alert the clinic that there may be a potential problem. The really good thing with both species is the symptoms are very similar in how they present. And we have an acronym in veterinary medicine, PUPD, and I'll explain there. That stands for polyuria polydipsia. So that would be the first symptom that a pet owner would see and might alert them to wanting to contact the clinic. Polyuria simply means that the cat is spending more time in the litter box, or the dog is wanting to go outside more frequently to urinate. And with the additional urination comes additional thirst. So they're spending a lot more time at the water bowl, taking in water. And these symptoms are all related to the increasing glucose levels associated with diabetes mellitus. The other big symptom that owners may see would be something called polyphagia, which is just a big name for wanting to eat a lot or having a big appetite. So that makes complete sense with this disease. The animal has got food in its bloodstream, but there's no insulin, so it's not getting into the cells. The glucose is not getting where it's needing to go. And so these animals are hungry all the time, always wanting to eat. So PU, PD, and polyphagia, those are the big symptoms.
Absolutely. I mean, many times my notes read the description PU, PD, PP, polyuria, polydipsia, polyphagia when I'm describing diabetic patients. So, of course, when we're presented with these patients, we want to get them started on treatment right away. Are there any advances in treatment options that we should be aware of when we're formulating a plan for these guys?
So it's probably worth noting that, of course, diabetes is complex in the sense that there's so many moving parts. And it's interesting that you specifically asked me about treatment, because especially when you look at dogs, treatment really centers around the need for insulin, for the hormone insulin. These dogs are essentially deficient in insulin. The pancreas is no longer able to produce it. So it's somewhat similar to what we see as type 1 diabetes in human beings. And so as far as treatment is concerned, it's essential that these dogs are getting a source of external insulin that's provided. As far as advances, it's been fairly quiet for a long time, especially if you look at the FDA-approved products. There's certainly a lot of insulin products out there for other species, mostly humans. But ProZinc was licensed for the use in dogs in 2019. And so this would be an advance to your question of an additional option that's out there. ProZinc, of course, is protamine zinc recombinant human insulin made by Boehringer Ingelheim. And it's very interesting in that it demonstrates a very clear extended duration of action. So what that means is that the insulin, after being administered, is more available inside the pet's bloodstream for a longer period of time. In fact, data would show it's greater than 18 hours to greater than 24 hours. So with this extended duration of action, this is truly an advancement, to answer your question, because this allows veterinarians to give an insulin to their canine patients where the majority of these diabetic dogs are only going to require once a day administration of ProZinc, of an insulin product. So we definitely see that as an advancement in options that veterinarians have to now take care of their diabetic canine patients.
Wow, that's a huge advantage. And I mean, of course, it doesn't eliminate the concern, but it certainly lessens the worry about missed doses or inappropriate spacing between doses and things like that. I understand there have been some changes in the ProZinc products that are available. Can you tell us a little bit about those?
So if you go back, I'll start off by saying if you go back to 2009, ProZinc was launched with a label indication for the control of signs associated with hyperglycemia and diabetes mellitus in cats. And so that presentation has been available for over 10 years in a 10 ml vial. And so that would be 40 international units per ml. With this approval for our canine indication, it necessitated an additional presentation, certainly to cater to canine patients that may very well be significantly bigger than cats. So with that, we have a 20 ml presentation, same dose concentration, 40 international units per ml, but that allows the veterinarian to choose between two presentations depending on the needs of the patient.
Oh, fantastic. I mean, most owners tend to appreciate fewer trips to the vet's office to pick up their pet's medication. So aside from the obvious benefits of being able to send a larger volume home at a time, can you touch on the benefits of this presentation of ProZinc to pet owners and veterinarians?
Great questions. And that's certainly what we spent a lot of time wanting to make sure that veterinarians understand and also provide that information to pet owners who may have a dog that suddenly presents with diabetes mellitus. I would like to start by maybe giving you a little context. There are fairly good data which would show that about 10% of all pets are actually euthanized at the time of a diabetes diagnosis. And a further 10% of dogs are then euthanized within the first year following diagnosis. So as you can see, there's a big component to diabetes in dogs and cats too, is that many of these animals don't get the benefit of even being treated. And I think it speaks to the huge commitment that is then borne out by the pet owner, because they're suddenly confronted with not only having to manage this complex disease, there's of course costs associated with that, visits back and forward to the clinic. There's probably diet changes, monitoring techniques, giving the insulin, of course. And so when you think out about what the pet owner is confronted with, again, another study has shown that almost 2/3 of the owners of diabetic dogs and cats have cited inconvenience of compliance with these daily injections as a big reason for wanting to decline treatment. An additional study has also shown that many owners, especially of diabetic dogs, feel that the treatment of these diabetic patients really restricts their activities, affects their working life, affects their home life. So there's a huge personal lifestyle component that I don't think we can underestimate what that impact is. So I think for the veterinarian, once a day for most dogs, in terms of insulin administration, really gives them an opportunity to bring something to the conversation, something that they probably haven't been able to really talk about to a large extent in the past. When a veterinarian is thinking about selecting an insulin, there's many considerations, including whether it's FDA approved for the use in dogs, is it specifically designed and made for dogs, but also, is this insulin of a sufficient duration of action that I can integrate it into an overall diabetes management plan? And so if we can give the veterinarian an insulin that provides once a day administration for most patients that will reliably regulate blood glucose, control those clinical signs, there's a huge benefit certainly for the pet owner, less injections for the dog, you didn't mention the dog, and certainly for the clinic, just a really good way for them to add a new dimension to an already complex conversation.
Yes, absolutely. I mean, the more options, the better when it comes to discussing diabetes treatment options for owners. Of course, insulin is a must-have in diabetic patients. And aside from once daily dosing, what are some of the other advantages of ProZinc specifically?
ProZinc is FDA approved for use in dogs. So what does that mean? That means that we had to do our due diligence in rigorously testing this insulin product, demonstrating that to the agency, FDA. And that testing, of course, encompasses two main components, safety and efficacy. And we were able to do this in the largest ever to date study here in the US, looking at an insulin treatment in dogs. So we had over 200 dogs enrolled in the study. And we were able to enroll both naive diabetics as well as those that had been previously treated with another insulin product. So that's sort of the backdrop. As I mentioned earlier as well, in canine diabetes, insulin is a have-to-have. There's no getting around that. So what does ProZinc bring to the equation? So firstly, it has a unique protamine zinc matrix, which of course is combined with a human recombinant insulin, so it's not sourced from animal product. And what does that mean? What does protamine zinc actually do as far as helping the clinical signs and the disease? So first and foremost, once it's administered, a small amount of active insulin is released into the bloodstream over that long extended duration that I was speaking about earlier. So insulin is available to take care of the glucose irrespective of what the blood glucose level looks like. So in the case of ProZinc, for example, a pet owner might administer ProZinc first thing in the morning alongside with a meal, and then during the course of the day, ProZinc goes to work. In the evening time, no need for that second injection, but the dog will take a second meal. As the glucose then starts to rise in the bloodstream, ProZinc is then available. Insulin is available to bring that blood glucose back down into appropriate levels. So it's taking care of high blood glucose and resolving those all-important clinical signs. And that's what's important to the owner, that urination, the drinking, the thirst, the excessive appetite. And our study was very successful. We were able to show improvement in about 62% of the dogs by day 14. And by the end of the efficacy part of the study, 87% of the dogs had showed improvement. And just to highlight again those two symptoms, PU, PD, we had 90 and 88% respectively control of our treatment population. And one other small metric which is worth noting, of course, is quality of life. So often we talk about clinical measures, but I think for pet owners, quality of life is equally important, not just for their beloved dog, but also for the folks that live with them and take care of them. And our quality of life measures in our study showed an 83% success rate. So we were very pleased that not only does ProZinc do what it says it does, but it does it for the huge majority of patients that are given the benefit of this insulin.
Is there an additional size syringe available for this insulin?
Yes, good question. I'd mentioned, of course, we have the two presentations, the 10 ml and the 20 ml. For those that might be familiar with using the 10 ml historically, the syringe was 0.33 cc's. So that allowed the person who was drawing up the insulin, administering it, ensuring that we got the exact dose. Precision dosing was really, really important. You certainly don't want to over or underdose. Now that we have the larger presentation, the 20 ml, we've also brought out a 1 cc syringe. So it's a larger cc syringe to match the larger volume with a larger patient, just to make sure that each patient gets the appropriate dose. So as I said, dosing, very, very important. And so we have those two presentations in dosing size as well.
Well, Dr. Beckett, we truly appreciate you joining us today, and thank you for all of this fantastic information. If I could just ask you one last question, can you discuss some of the resources that Boehringer Ingelheim has made available to help pet owners with home care, and then also to help veterinarians and technicians?
Excellent question. I would say that one of the things that we realized early on was we are, of course, very happy to bring an exciting insulin option to the equation. But we quickly realized that diabetes is very complex. And so we wanted to ensure that we provided some additional resources that can really help those that target audience that you just referenced. So a couple of things that are worth mentioning. Firstly, we have care kits that come and are available alongside our ProZinc insulin. So what does the care kit have? It comes with 100 syringes appropriate to the size of the vial, as well as a waste disposal unit. So that means the pet owners do not have to worry about needles and syringes lying around. They can just quickly dispose of it in this actual kit. Additionally, we have some custom-made information brochures for pet owners that speak to both canine and feline diabetes, so good information about the disease and managing the disease. We have an outstanding online resource at prozinc.us. And one of the things I'd like to specifically call out on the website is a video series called You Can Do This. And it's aimed, of course, at pet owners and specifically has step-by-step videos where a veterinarian will walk the owner through taking care of insulin, how to draw up an appropriate insulin dose, and of course the all-important administration to both a dog or a cat. We also have a home diary and some reminder magnets, which will help the family to track all components of the diabetes management at home. As far as veterinarians and techs are concerned, two important things I'd like to alert you to. Firstly, we have a treatment guide. We believe that now that we have brought this once-a-day component to canine diabetes, as far as insulin is concerned, we needed to provide veterinarians with a step-by-step guide for how do they start those patients and how do they sustain that treatment in terms of monitoring, dose titration, and expectations to ultimately successfully regulate the dog and get them back on track. So the guide is an essential piece for the veterinarian. And as always, for all of our products at Boehringer Ingelheim, we have an outstanding group of veterinarians and veterinary technicians on our technical support line. So they are always available to talk with veterinarians on any of our products. And certainly ProZinc is no exception.
Wonderful. I mean, this is such a complicated and involved disease. I'm so glad to hear about all the resources available to make it easier to manage where possible. And as we wrap up, is there any safety information we should be aware of when using ProZinc?
Absolutely. So ProZinc is for use in dogs and cats only. Has to be kept out of the reach of children. Animals that are presenting with ketoacidosis, anorexia, lethargy, and or vomiting should first be stabilized with a shorter acting insulin and appropriate supportive therapy until their condition has stabilized. As with any insulin products, careful patient monitoring for hypoglycemia and hyperglycemia is essential to attain and maintain adequate glycemic control and to prevent any associated complications. The overdose of an insulin can result in profound hypoglycemia and even death. The most common adverse reactions are lethargy, anorexia, hypoglycemia, vomiting, seizures, diarrhea, ataxia, and we see shaking sometimes in dogs. Many of these adverse reactions, such as lethargy, seizures, dogs shaking, and ataxia, are associated with hypoglycemia. Progestogen and glucocorticoid use should also be avoided concurrently with ProZinc. And the safety and effectiveness of ProZinc in kittens, puppies, or breeding, pregnant, and lactating animals has not been evaluated. ProZinc is contraindicated during episodes of hypoglycemia and in animals sensitive to protamine, zinc, recombinant human insulin, or any of the other ingredients in ProZinc. And you can get the full prescribing information, of course, at the website, prozinc.us. And that's it.
Fantastic. Thank you again, Dr. Beckett, for being with us. We truly appreciate your time. I look forward to getting the word out about all of this great information about ProZinc and the additional options we have when managing diabetes.
Thank you so much. I'm certainly the one that appreciates getting the opportunity. Yes, we absolutely are excited about our product available for canine diabetes. And as I mentioned before, prozinc.us, plenty of good information there. And I also do wish that our paths cross again soon. So thank you very much as well. Take care.
Thank you so much for joining us, Dr. Beckett, and thank you to Boehringer Ingelheim for sponsoring this event. If you'd like to find more episodes like this, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.